You have to love working with people and want to do something for them to help, improve their life, or you probably wouldn't be in healthcare very long.
Well, I had a patient up in Camp Point, and I delivered oxygen tanks to her every week for probably 12 to 13 years. She's one of my favorite people.
Sometimes you got to stop and think about what it's all about. What it's all about is the person that's laying in that bed that's being cared for. At Denman Biomedical Services, we make sure that our quality of our work is about the human at the other end. Patient care is up on the upper floors, but we're the ones supporting all the people that are in the trenches doing the work. It means that you don't cut corners, and it's never just good enough. Anytime you work on a piece of equipment, you work on it like your family member is going on it next. It's my mother, my father, my sister on it next, which has actually happened to me before. And I think of it as, I don't ever want to be part of why something didn't go right. I need to make sure that this piece of equipment is right every time. Medical equipment is equipment by prescription, and that piece, it is always in our mind that it's going to go on a person, and we have to make sure that it is safe for that person.
Adaptive Mobility provides services to pediatric through geriatric, so it's the whole gamut. So, I have the great fortune of getting to work with kids and adults and everything in between.
Okay, stand back, Jane. What do you think? Okay.
I would say for adaptive mobility, it would be we're present at the time of the evaluation and we're present at the time of the delivery.
They want to make sure that it's done right. Honestly, I can't think of another company that I've dealt with in 17 years of doing this that notified me of the delivery.
I think sometimes people focus too much on the sale and not so much on the person.
The person who evaluates you for the chair, delivers the chair, follows up on the chair, it's all the same person. So I think the patients really feel like they know her.
To develop that relationship is really great.
Well, when I started, I had to have oxygen. I could not get along at all without it, and it's 24/7.
Anything that can be used at the hospital can be used in the home, and those services are rendered from Denman Medical.
Denman set me up with everything because they knew what I needed with being in the hospital.
Just making sure that we are having a very clean discharge process.
They set me up with everything, yes. They came in and talked to me, told me what it was all about.
Anything that we do for the patient is what's best for that patient.
They know me very well, yeah. There's a relationship there, especially when you've dealt with them for several years or more. They recognize you by name when you come in the door, and they're very, very kind to you.
At Denman London, when we talk about customers, we not only have to talk about the patients, the end user, but also our customers are the clinicians.
To us, we know there's someone that's going to be using that linen, there's going to be a person on that, so we all want to ensure that we put out the best product that we have.
Probably one of the biggest things that we did this year is we recapitalized our linen plant. A major new piece of equipment called a tunnel, and added to that we also put in a new what we call a sort-on-rail system.
Quality is number one at Denman because we know there's going to be someone using this linen.
They're not just delivering carts, they're not just stocking shelves, that there's a patient that's going to use that linen, and we need to make sure that it's a good product.
So oftentimes we have patients that have no insurance, no funding source, that need to get home from the hospital. The Blessing Foundation helps us out, helps pay for these customers' supplies and or equipment so they can get home.
The patient is the center around everything we do. And the Blessing Foundation's role is to support every clinical department in the health system.
Sometimes I think people get into the track that it's not covered or we can't have that, instead of offering it and trying to find a way to get funding or help someone procure something that you truly know that they need.
Their passion is right there. So to me, the Denman Services Inc. folks get it.
It's the right thing to do. These people need this piece of equipment. Can be very challenging. It can be very stressful too.
But you know what? It's the right thing to do. And the patient is always the center around everything we do.
I know that we have heard feedback from patients that have visited other organizations that we have something special.
So whether you're a patient at Denman Medical, Hannibal Medical, Alliant Eye Health Services, or Macomb Medical, it's really about taking care of the patient and making them understand that they're just not a sale.
Because you really grow attached to these people.
And that to me just says they're listening, they're caring.
Make a difference in their life, give them the opportunity to be able to maybe do something that they couldn't do without that piece of equipment.
The employees, the frontline people, see everything.
We build long-term relationships with our customers. It's almost like they're part of our family.
So it's just a great group of people. Honestly, between Denman Services, the foundation, and a care manager, it's a great team of people that come together with their expertise and do the right thing every time.